Well, earlier I spoke to Bruno Megaban. He is head of an intensive care unit in Paris. Since France has already reported at least 240 Omicron cases, I began by asking him whether these travel restrictions would make any difference now.
We are afraid that the Omicron strain may spread rapidly in France due to the traveling from the UK. Because to date, it has been estimated that almost Omicron incidence is 100 times the one in France. So by limiting the traveling between UK and France, we may limit and slow down the diffusion of this strain. Because almost in France, the ICU beds are already saturated. We have about 2,800 persons admitted to the ICU for severe COVID-19. And as you may know, that our capacity is relatively limited because of the absence of caregivers. So we have only 5,500 beds to date.
The point I was making, though, Mr. Magaban, is that with 240 cases already, we know how transmissible this variant is. The chances are it's already taken hold in France.
Yeah, yes, you're exact. It is possible that to have local spread of the Omicron strain. But if you have imported cases, then you may increase the spread. So in France, we are isolating all these cases and making a screening of the people that are in contact with those people. But of course, the Omicron cases are increasing, maybe doubling each 2 to 3 days, like in the UK. But the figures are still low, although we don't know the exact number of the people infected with this strain, because probably the sequencing methods in France are less available than in the UK.
Okay, the real issue and the problem for people in the UK and the fear in the UK is that the NHS, the National Health Service, will be overwhelmed because a lot of medical staff, frontline medical staff, will probably come down with this variant as well, although we're not quite clear how virulent and in fact how extreme it is in terms of what it does to their health. In terms of vaccination, what is the situation in France? Are all frontline health workers, for example, forced to be vaccinated?
Yeah, you're right. The coverage of vaccination in France is relatively good. Almost 85% of the adult population is vaccinated. However, there is still a proportion of older people who are not vaccinated, over 80 years, maybe 15%, and despite all the recommendations, it's difficult to access to them. And those people, unfortunately, are dying when infected by coronavirus. To date, almost 75% of the patients admitted to the ICU in France are not vaccinated. And the caregivers are all vaccinated, and now there is a campaign for the third dose, the booster dose, and it's going relatively well. So we are preparing ourselves to combat the new strain, but the frighten is still here. And we think that by limiting the entrance of tourists coming from the UK, maybe we can slow down the entrance of this new strain.
On a personal level, how do you feel when you are treating people suffering from COVID, if not the Omicron variant at the moment, who have refused to have a vaccination?
Yeah, I agree. Of course, as a physician, we treat and manage all the patients, even though if they have not been vaccinated. But now we face two kinds of non-vaccinated patients. Those who are anti-vax and decided by themselves not to vaccinate themselves, and sometimes even they have pass that are false. But we have to manage them and treat them.
Yeah, but,
and
how do you feel about that when they are taking up
I
beds?
feel relatively sad, of course, sad because they would have not been in the ICU. They would have not faced the risk of dying if they have been vaccinated.
Bruno Meraban speaking to me a little earlier.